This is my first hospital blog here at Franklin Square. The date is March, I'm thinking the 8th. Yeah, 2014 on a Saturday, on a Sabbath. Unfortunately, I was called to come into the hospital on Tuesday because of a possible infection, which I found out it does not exist, but I did need a surgery. Besides the point, my problem is the integrity of the question and answering of the hospital. They'll ask you the same 12 questions for each person you meet, regardless of their position and the differential in their jobs, whether it be the same or different. But when you answer questions, even if it's the same exact questions, you never get direct answers. I think these hospitals should know that some patients are intelligent enough to understand the answers that you give them medically, or if not, in a layman's term. It should be made understood. For example, when I come in the hospital, I answer as much as I can, but I answer as least of the things that will take away help from me, so to say. Yes, I am paralyzed, and I normally do a lot of everything by myself. I live on my own. But when I get into these hospitals, because you're going through surgeries and things like that, you don't know what type of help you're going to need. And if you nullify that help now, later on they'll be like, oh, he can do it himself. I don't want to get into that. So I'm paralyzed from here down, and I can barely do anything. I'm going to need help. That's the way I put it when I come into the hospital, until I'm well. And then they'll see the transition to me doing everything for myself. But on the other hand, when I ask them questions, such as when I came out of surgery yesterday, I was hurting so bad. I said, well, what happened back there? Oh, yeah, we just had surgery. I know I just had surgery. What did y'all do? Oh, well, it was just a surgical procedure. Now you beating around the bush. What happened to the food? Because they starved me all day. I ain't going to surgery till 3 p.m. They starved me from midnight the day before. Literally. And she said, oh, I got you. Didn't I tell you I got you? She took a spoon and slid one piece of hospital ice. You know them things is teeny and round. Slid one piece of ice in my mouth and started asking me these questions that literally were putting me to sleep after she gave me a shot of fentanyl. I go to sleep for maybe a minute, come back up, be like, well, what happened? Because this pain is killing me. Oh, it was just a surgery. I don't know why y'all keep saying that. This was just really getting on my nerves. What did you mean it's just a surgery? I know I was in surgery and now I'm in recovery. You know what I mean? Where's the food? Here comes the one piece of ice again. Here comes the questions with the fentanyl until I go to sleep again. This time I wake up, I'm going in the sand. Oh, your transportation's here. They'll take you upstairs. Your food should be there when you get there. I got here and my food was not here. My nurse went on to tell me that I could not eat until a doctor decided to get here and say I could eat. Well, the only thing that was stopping me from eating was the anesthesia for the surgery. That's over. Why can't I eat now? I can't let you eat if the doctor don't say so. What? See, all y'all had to do was say that from the jump. Look, man, we can't tell you when you'll eat. You'll eat when the doctor gives you orders. Not in the recovery room after you get out of surgery. We're going to have crackers and cookies and ice cream for you when you got 2 pieces of ice. Not when I get back to the room. Oh, we'll save your dinner tray or your lunch tray for you. Well, you haven't saved me nothing. You got to order a whole new tray. And secondly, I have the integrity to eat right. So I don't need y'all to put me on a renal diet and tell me this is how I'm eating at home. Because this old bland, nasty food y'all feed me is not how I'm eating at home. I eat very good at home. Very, very good. And even though I indulge in some things that most dietitians say maybe you shouldn't, I indulge in smaller portions that are controlled with exercise, plenty of water, and medicines that are given to help bind them. They're called binders. Sometimes you have to trust what a patient says. If a patient is uncomfortable, he's uncomfortable. If a patient says, this is my body, I know my body, then I know my body. I had a lady last Tuesday, not this Tuesday past, but the one before, reason why I'm here, tell me, oh, his blood pressure is skyrocketing. This isn't normal for you, Mr. Jennings. Mind you, this is the only second time she ever took my blood pressure in life, and I bet you she don't even remember the first time. And I tell her, I said, yeah, this is normal. My blood pressure normally runs 260 something over 160, 180 something. Well, you could be having a stroke. No, I can't be having a stroke, because if that was the case, this does this almost every day, and I haven't had a stroke yet. This is God. That's what's up. Y'all believe in the numbers and science and what man tells you. I believe in the Heavenly Father by faith, by heart, by soul, by mind. That's a big difference. So she runs out of the room and tells my doctor, oh, he's being uncooperative. He needs to let me do it again. Did you hear me in that whole conversation? Did you hear me say that she could not take the pressure again to check to see if what she saw was wrong? I just told her this was a normal thing, so expect it. So of course she took it again after my doctor came in and scolded me like a child. Now I'm really pissed off. Mind you, it was already high because I was having an anxiety attack that he refuses to treat in the parking lot because I almost fell out of my car onto the ground, getting in my chair. Scratched it. She takes it again, it's higher. It's like 270 something over 180 something. Now she says, oh, we can't see you. Why can't you see me? I was at his office, his regular office. He saw me when my pressure was high. I go to dialysis. They know my pressure is high so well, they'll let me dialyze. What makes you different? We supposed to have you go to the emergency room. Okay. People know their own body, people. Not all people, but some. And when you get some, you need to listen. Because these be the people that you be killing, running all these unnecessary tests, doing all this unnecessary stuff, when they telling you from the jump what the actual problem is. That's what that be. Y'all need to get it right. And y'all need to respect the right for patient suggestion. It's part of your patient rights. You need to keep them rights next to your bed if you don't know them by heart. See, I'm a patient advocate, so I know them. You have the right to suggest your own treatment. If you don't want an MRI, but instead you want a CAT scan, you can have that done. Don't tell them that that's the last resort. If you don't want blood transfused into you, then you don't want blood transfused into you. They have other options for that. It's called building your blood up. Jehovah's Witnesses know about it. I know about it. So Israelite and everyone else should know about it too. I'm not going to bind you with a lot of your time this morning. I just wanted to say hey to everyone. Had a little frustration on my mind. And unfortunately, I won't be able to continue the 613 mitzvahs this afternoon. Last afternoon, I had a question and answer class during Bible study. And this week, I don't think there will be Bible study at all because of my hospitalization. You have a good day. May God bless you all. May God bless your children, all the generations after yourselves. May He bless your storehouse. May He bless your home. May He bless your finances. May He bless you in all you do. The ways of His Son, I pray. Salah.